Hello everybody, let's talk about the relations of the kidney today. So we've already seen the gross anatomy of the kidney. We know that there are two bean-shaped organs located retroperitoneally on either side of the vertebral column. We also saw that the right kidney is slightly lower than the left kidney because of the liver which is located on the right side, and the entire kidney extends from T12 vertebra, the 12th thoracic, to the 3rd lumbar vertebra. And today we'll be seeing the relations of the kidney, and for that we have to place all abdominal organs in situ, take them out one by one and see how they are related to the kidney. So the relations of the kidney can be seen as anterior relations as well as posterior relations. We'll see the anterior relations first. On the screen what you can see are the organs that are placed in their anatomical position, and this is how you would see the abdominal organs once you remove and flap the abdominal anterior wall. So let's zoom in and remove each of these organs one by one till we reach the kidney. Then we'll replace them and study the relations on the kidney. Alright, so the first one to go will be the greater omentum, and once you remove the greater omentum, what you see are the intestines and the large intestine, okay, the small intestine and the large intestine, the colon. And once you remove the colon, what you can see are the structures which are part of the posterior abdominal wall. You can see the duodenum over there, then the stomach, and a bit of the spleen perhaps within the rib cage, as well as the liver. Now let's remove the stomach, and that will show us the pancreas which is lying behind the stomach. Now the spleen is becoming clearer and we are starting to see the kidneys. Let's remove the spleen from the left side, and now you can see that the pancreas is lying right across the vertebral column and lying on top of the left kidney and not the right kidney which is on this side. Alright, now let's remove the liver, and that shows us the kidneys with the suprarenals as well as the duodenum and the pancreas. We'll remove the duodenum and the pancreas now, and we can see the kidneys. Let's, for completion's sake, just remove the suprarenals also. Alright, so there you have the kidneys. Let's go for the anterior relations of the right kidney now. Alright, so here we have the right kidney. We have seen the diagram in our textbook. We'll see how these organs lie on the kidney. Let's see them, and for that we'll have to place them one by one. Alright, so the right suprarenal is on top. So the superior pole of the right kidney is related to the right suprarenal. Then you have the liver, which is a major relation. So a major part of the anterior surface of the kidney is related to the right lobe of the liver. Then we have the second part of the duodenum, which is here, the C loop. That is what we call the C loop of the duodenum, followed by the right colic flexure, also called the hepatic flexure, as well as a few loops of the jejunum. Alright, so the jejunum and the colic flexure are there, and finally we can see how each of these organs form the relation on the surface of the kidney. We have given them in these colors. I've given them these colors, and let's zoom in and then try to identify them. Alright, so this is the picture that we see in our textbook. We'll place each of these organs and name the areas. So the superior pole is related to the right suprarenal. The major part of the anterior surface, the upper half of the anterior surface of the kidney, we have the right lobe of the liver. Along the hilum, we have the C loop, or the second part of the duodenum. In the lower part of the anterior surface, we have the hepatic flexure of the colon, and then in the lower pole we have the jejunum. So there you have the relations, the anterior relations of the right kidney. Now let's see what are the relations of the left kidney. So let's zoom in on that part, and here let's already place the colors. So this is what we are seeing in our textbook. Okay, and now we'll place the organs in each of these colored areas, and then we'll identify them. Alright, so the left suprarenal, obviously the upper part of both kidneys are related to the suprarenal. So you have the suprarenals on the top, the superior poles. Then let's place the spleen. So the spleen is an organ which is placed on the left side. Its long axis lies along the 10th rib, and that forms the lateral relation, or the relation along the upper part of the lateral border of the left kidney. Then we can place the pancreas and the splenic vessels. You can see that the splenic vessels are coming all the way into the hilum of the kidney, of the spleen, right? Next, we'll place the colon and the small intestine, and here we have the splenic loop or the splenic flexure of the colon, left colic flexure plus a few loops of the jejunum similar to the right side, and finally we can place the stomach. So let's bring out those relations and name them. So here we have the left suprarenal over the superior pole as well as the convex medial border. Then we have the spleen over the convex lateral border upper half, the pancreas, a small triangular area along the hilum, the splenic flexure along the lateral border lower half, the jejunum along the inferior pole and the anterior surface, as well as the upper part of the anterior surface related to the stomach. Alright, so there we have the anti-relations of both kidneys. These can be asked individually or together. So remember this diagram. Let's go to the posterior relations. So let's go back to this diagram or this picture that we have already seen, and we have placed the kidneys. Let's zoom in and let's remove all these other structures here. Let's go for that, and we know that the kidneys, we just need the posterior relation, so we'll have to turn this around, twist it around and look at it from behind. Don't get confused. This is still the left kidney. You're looking at the patient from behind. So imagine you're looking at the body from behind. The patient is standing in front of you. So your left side will be the patient's left side. Your right side is the patient's right side. So the right kidney is lower and the left kidney is higher. And the first structure, or let's first place the muscle relations on the posterior aspect. So the diaphragm is the major muscle which is related to both the upper poles of both kidneys. So there you go, there you have the diaphragm. We then have three vertical muscles, starting with the psoas major, which is the medial most over here, then the quadratus lumborum, which is in the center, and finally the transversus abdominis, which is a muscle from the anterior abdominal wall going back and forming the posterior relations of the kidney. So these are the three muscles. So if you go to your textbook and see the relations, you can see there are three vertical lines or segments and the diaphragm on top. Okay, so this is how these muscles form the relations of the posterior side. Okay, now that is the kidney over there. You can see how those muscles are related to the posterior surfaces of the kidney. But apart from that, we also have bony relations. So if you remove the other ribs, you can see that the last two ribs are related to the kidney, and on the left side you have both the 11th and the 12th ribs plus the 11th intercostal space. Whereas on the right side, since the right kidney is lower, we have just got the 12th rib. Let's color in the diaphragm. It has already come in. It's pink. Let's place the coloring or the position of the psoas major medial most, followed by the quadratus lumborum lateral to the psoas major, and then we have the transversus abdominis. Okay, so apart from this, we also have three nerves and vessels related to the posterior surface. And to know that, you have to remember that the spinal cord is in the center and the nerves or the spinal nerves always go out laterally downwards. So the first nerve that you see over there, that is seen immediately below the 12th rib, and that is why it is called the subcostal nerve. It runs along with its vessels. So subcostal nerves and vessels are the superior most relationships, neurovascular relationship. Below that, we get two nerves coming from the L1 level. The higher one is iliohypogastric. Did you remember did you just notice what I did there? Higher one is iliohypogastric and the lower one is ilioinguinal, but they are both having a root value of L1. So there you have it, ilioinguinal and iliohypogastric. So these two nerves also form the posterior relations of the kidney. So this is how the diagram comes in the textbook, and now you understand how they are all related. With that, we'll stop this short topic and we'll see you in the next class. Thank you.